There are approximately 300 million people suffering from depression worldwide, an alarming and ever-increasing figure, especially among young people and adolescents. It is one of the most common and disabling mental disorders, often nicknamed as the disease of the soul, and according to the World Health Organization's forecasts, it will be the second leading cause of disability due to illness, immediately after cardiovascular diseases. The term depression is used to generically indicate some depressive disorders that share a series of physical and psychological symptoms, but which can vary in terms of severity, duration, and triggering factors. One of these is major depression, which can affect anyone at any age, but statistics show a higher incidence in the age group between 25 and 44, and a frequency double in women compared to men. According to the DSM-5, the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, edited in 2013 by the American Psychiatric Association, major depression manifests itself with a series of very specific signs and symptoms. In order to receive a diagnosis, the patient must have experienced at least 5 of the following 9 symptoms for a period of at least 2 weeks. 1. Depressed mood. Depression is not to be confused with the normal moments of sadness that we can all experience throughout our lives, especially when we go through difficult periods, such as bereavement, the end of a relationship, an illness, or the loss of a job. Although these are all painful and difficult experiences to deal with the passage of time they tend to ease, thus allowing a gradual return to normality. Depression, on the other hand, contrary to what many people think, is not a temporary and passing phase, nor a sign of personal weakness. Those who suffer from depression, therefore, have a persistently low mood and feel a constant sensation of sadness, which does not tend to improve as the days go by. 2. Loss of interest and pleasure. In the initial stages of depression, the depressed person complains of no longer being able to derive satisfaction from normal daily activities. He thus feels a marked decrease or a total absence of pleasure for all those activities that he once found pleasant and fun. In medicine, it is indicated with the term anhedonia, and indicates precisely the reduced capacity or total inability to experience pleasure and satisfaction in all its forms. It can be social, when the disinterest is aimed only at interpersonal relationships, while it is physical, when food, sex, or emotions do not cause any pleasure to the subject. This inability to experience satisfaction often leads to a loss of motivation and a feeling of apathy, which amplify the sense of confusion and isolation in the depressed person. 3. Weight or appetite changes. Depression can lead to a number of biochemical and behavioral changes, such as disruption of the hypothalamic pituitary adrenal axis and a tendency to be sedentary, thus negatively affecting metabolism and body weight. The link between depression and weight changes, however, is very complex and depends on a series of factors, including individual variability in emotional responses. Some people may seek comfort in food and therefore ingest a high amount of calories, often from foods high in sugar or fat, which inevitably cause weight gain. Other people, however, may experience a lack of appetite, aggravated by a loss of interest in food. This condition can lead to a significant reduction in calorie intake and subsequent weight loss. 4. Insomnia or hypersomnia. Insomnia and hypersomnia are two sides of the same coin. The first indicates a sleep disorder characterized by difficulty falling asleep and/or staying asleep during the night. The second, however, indicates an excessive need to sleep, or a state of continuous drowsiness that makes the patient feel perpetually tired and unmotivated. There is thus a very strong association between sleep disturbances and major depression, so much so that some researchers have suggested that a diagnosis of depression in the absence of sleep disturbances should be made with caution. A study conducted at the Psychopharmacology Unit at the University of Bristol found symptoms of insomnia in approximately 75% of depressed patients, while hypersomnia in 40% of young adults and 10% of older patients, with a higher frequency in women. 5. Psychomotor agitation or retardation. These are two opposite manifestations that can occur in cases of depression. Psychomotor agitation indicates an extreme form of excitement, a state of internal tension characterized by an increase in verbal and motor activity, not aimed at something and therefore not productive. Among the main symptoms we find the inability to sit still, frequent pacing, nervously rubbing one's hands together, and constantly touching clothes or other objects. On the contrary, psychomotor retardation indicates an alteration of the psychic faculties that causes a deficit of voluntary motility and activities. The language thus becomes less fluid, short, and monosyllabic sentences with excessive pauses before responding. Thoughts and body movements slow down, reducing the ability to concentrate and make even simple decisions. 6. Fatigue or loss of energy. Fatigue associated with depression is profoundly influenced by a series of physiological mechanisms that compromise the functioning of certain biochemical processes, leading to an imbalance in neurotransmitters, systemic inflammation, and an alteration of sleep architecture. The patient will feel tired and lacking energy throughout the day, making it difficult to carry out normal daily activities, with a tendency to isolate themselves and withdraw from family and friends, avoiding any type of social contact. 7. Feelings of worthlessness or excessive or inappropriate guilt. Those who suffer from depression tend to manifest feelings of guilt, self-criticism, and excessive self-depreciation, accompanied by a sense of inadequacy and an inferiority complex. This perceived sense of inferiority may concern specific activities, for example at work, at school, or in sports, or the perception of one's body or the entire personality. The depressed person continually blames himself and broods over mistakes and faults, real or more frequently presumed, that he has committed in the past or that may be the cause of his discomfort. His mind is invaded by continuous negative and catastrophic thoughts about himself, the world, and the future that awaits him. Depression is marked by a distorted perception of time, with a looming past, an impossible future devoid of hope and planning, and a present lived with a profound sense of emptiness and total apathy. 8. Diminished ability to think or concentrate. Other symptoms of major depression include difficulty concentrating, which prevents one from carefully reading a book or following the plot of a film or TV series. Reduced thinking ability and indecision, on the other hand, can manifest themselves with difficulty making decisions, even simple ones. Low self-esteem and lack of confidence in one's own abilities lead the depressed patient to fear making the wrong decision, increasing the fear of making mistakes and being judged negatively. 9. Recurring thoughts of death. People with major depression often experience thoughts of death, ranging from a passive desire not to wake up the next morning to the belief that others would be better off without them. In more severe cases of depression, these thoughts can turn into concrete actions, with the development of more or less specific plans to end one's life. The symptoms listed above, therefore, must be present almost every day, with the exception of recurrent thoughts of death and changes in body weight. Depressed mood must characterize almost all of the patient's life, while insomnia or fatigue are two warning signs of the onset of a depressive condition. In conclusion, we have seen how depression is a complex disease due to multiple causes and linked to an intricate network of neural systems, that is, various areas of the brain that interact with each other and influence emotions, thoughts, and behaviors. If you suspect that you are suffering from a depressive disorder, it is best to contact a specialist immediately in order to receive a correct and timely diagnosis, as well as the most suitable treatment for your medical condition, whether pharmacological or therapeutic. It is important to remember that you are not alone. Many, like you, are facing a similar challenge, and seeking help is not a sign of weakness, but of strength.